Hello from Chiang Mai and RP, Renal Disease and Biotechnology meeting organized by Professor Ronco. We are going to take a cappuccino with Nata Ronco and Professor Ostermann. Thank you very much for joining.
Thank you.
Ciao mondo, hello world, hola mundo. Hello mon, konnichiwa, ni hao, namaste, and?
Good morning.
Well, in Thailand, where we are in Chiang Mai, they say sawadee-ka. It's a way to say hello in Thailandese, and in fact, we are in Chiang Mai for the Renal Disease and Biotechnology meeting organized by Professor Ronco. And I'm with an old friend, Marlis Ostermann, who will speak in this case about the use of pharmacological approach to prevent AKI, to protect the kidney, and possibly to open up a completely new vision on how we can avoid the progression towards AKD and CKD. So Marlis, can you just comment on this?
Sure. So I'm very concerned about the fact that worldwide 13 million people develop acute kidney injury every year, and in the intensive care unit it's about 1 in 2. So to date we have very little pharmacological tools to prevent acute kidney injury. But we have some indirect evidence and exciting news from the field of cardiovascular medicine, where SGLT2 inhibitors, so sodium glucose co-transporter 2 inhibitors, have shown to be very, very effective. And in one of these trials conducted in patients with COVID-19, it also turned out that patients who've been randomized to SGLT2 inhibitors had less acute kidney injury. The hypothesis is that these drugs prevent hyperfiltration and improve renal hypoxia. And so this really interesting trial in patients with COVID-19 led to an editorial suggesting and asking for suggesting an urgent need to investigate these drugs in critically ill patients with acute kidney injury or at risk of acute kidney injury. And I think it's very exciting because on the one hand, these drugs can cause a temporary rise in creatinine, and they can also cause euglycemic ketoacidosis, so potentially causing some concerns or risks. On the other hand, they may be renal protective, and I think there's an urgent need to study these drugs. And I'm delighted to collaborate with colleagues at the George Institute in Australia, and together we secured some funding and want to embark on this. And I think it's exciting because it may be that these drugs work, which would be fantastic in the field of acute kidney injury. At the same time, if we show there is more harm, then again, that's important for clinicians working in the intensive care unit.
Yeah, I see from the program there is also talk on GLP-1 receptor antagonists. Yeah. We have discussed about using renal angiotensin, aldosterone system antagonist, and other type of drugs. I think combining drugs together with our extracorporeal therapies will be a more complete vision on AKI therapy, not only to replace renal function, but possibly to sustain renal function and avoid the further damage to the kidney. So hopefully we will have more chat in the Vicenza course in June 2025. So join Vicenza course in June 2025, and we will have more pharmacological approach combined with CRT and other therapies for AKI. Thank you for joining today Cappuccino in Chiang Mai, Thailand, with Marlis Ostermann and many old friends. Excellent.
Excellent.